Safari doctors provide vital health services to remote communities that lack access to these health facilities. They are an excellent example of locally led solutions to problems faced by these communities. Today, we will join one of their monthly outreach programs, and we will get to see how, in their journey for change, over the years, how they have also changed. In 2015, Umra Omar founded Safari Doctors to solve her community's challenging health access problem. Despite the security concerns, Safari Doctors traveled to marginalized villages to provide free medical services.
I joined Safari Doctors in 2015, and at that time I was just an intern, and I met Umra Omar during that time in a small office, and during that time we were only 3 staff in the Safari Doctors organization. It was the founder Umra Omar, Mariam Abdallah as an intern, and Harrison Kalu. And during that time we used to do outreaches on a motorbike. Kalu had a motorbike and he was based in Mangai, Woni Forest, and the service he used to do was delivering immunization to children under 5. So came 2016, Umra won the CNN Hero Award, and that's when we started to grow.
Lamu County is made up of a group of isolated islands. The archipelago presents challenging health access problems. Safari doctors travel by air, boat, road, and walk to the most remote villages to provide health services. They started with 2 villages and now visit about 23 villages monthly.
First of all, we do disease diagnosis and treatment and management of those diseases. And second of all, we also do education among the communities that we visit every single month.
If you give them the right information they want to hear, why are you taking your medications? You are taking your medications to prevent the complications that comes with the hypertension. You are taking your medications if it's hypertension to prevent the complications that comes with that. May it be like, for example, stroke, heart attack, chronic kidney failure. Now, when you talk to them like that, they understand why they take their medications each and every morning.
From a medical perspective, the changes that I've seen in the communities is that each time we have our interactions and we have informal health chats and some more formal education, they come to you and they know quite a lot about their own conditions, and it's really nice to kind of see a community start to take ownership of their own health. Like, they're there, they want the immunizations, they want access to family planning, they want access to the right medicines.
Safari Doctors is now expanding to preventive health by training youth health ambassadors to address population health and environmental awareness issues.
The idea of having youth health ambassadors with Safari Doctors was initially to just have a linkage between the community and Safari Doctors. As they link us, we know what are the current issues at the community, and also to inform the kind of drugs we bring back to the community as we come for the outreaches. So if we have that, and we have trained them in different health issues, for instance, first aid, population health and environment. We have water hygiene and sanitation, sexual reproductive health and rights. So initially it was just ad hoc and asking them to just teach a few people at the community and having that trickle down of information. So it became a peer-to-peer learning for the youth health ambassador.
natuma ripoti huko kama ambassador, na wanakuja kila mwezi. Wananipigia simu, wananipatia tarehe yenye watakuja. Wakinipa tarehe, nitaongea na mzee wa mtaa na chifu, kisha nitamobilize community wajue hiyo siku na masaa. Kisha kuna kupanga, kwa sababu lazima kuwe na ground yenye itafanyikia hiyo shughuli ya matibabu. Hii ground ni kwa watu hapa, hizi ni ploti za watu, lakini unaongea nao kwa sababu ni kama ndio center. Sasa ukiongea na yule na huyu na wanaelewa ni kitu ya kusaidia jamii, wanakubali.
We used to have only outreaches. Now we have veterinary services. We deliver veterinary services free of charge. Safari doctors, we do believe in One Health. We do treat human, and now we treat animals.
Yes, and Corona was a good example of how the health of animals and the health of human beings are connected.
These communities in Lamu, and not only in Lamu, in very many parts of Kenya, have a very close relationship with their animals, so that puts them at risk of diseases transferring from animals to human beings. Our doctors get to see people with skin issues that they mostly acquire from animals. This is where we come in. We try to manage and mitigate and control the diseases so that they don't jump over to the human beings.
When we're thinking about community health and thinking about health in rural settings, we can't think about human health without thinking about animals as well. We believe that if you just treat the humans, then you're not going to be uplifting the whole community to do so. And that kind of comes under the umbrella of One Health.
I've noticed something very interesting. The founding member, Umra, is a woman. You are the current acting director as a woman, and one of your doctors, Sarah, is a woman. And now with the new boat, you're calling it Mama Daktari. Why is the boat called Mama Daktari?
Before Safari Doctors, there was an organization called Sailing Doctors. This Sailing Doctors was founded by a French woman. People used to call her Mama Daktari. That's how we named our boat Mama Daktari. Then, in my view, I can see that we named the boat Mama Daktari. In our community, a mother is in charge of the health of her family. And also in the villages which we visit, most of the patients who comes to seek for our services are women.
So you rightfully chose the best name possible. Because once I was told it's called Mama Daktari, I could not think of any other name that would have been more appropriate other than Mama Daktari. We're going to broadcast this to the world. What would you like to tell the world? Because you guys need donors, you guys need support. You've talked about expenses for referral cases that you're not able to cover. So what would you tell the world?
What I have is, as Safari Doctors, we do believe healthcare is a right and not a privilege to everyone. So what I want people to join us and make this journey for change a successful.
From one room in Lamu with only 3 offices, Safari Doctors was able to offer excellent free services that attracted so much demand. Now, they're able to visit up to 23 villages, serving over 2,000 patients. What started as a youth-led program has grown into an operation that works in conjunction with the government, is able to attract grants and partners from across the globe. This journey for change not only transformed the communities, but the Safari Doctors themselves.